Okay, good morning, everyone. Let's go ahead and get started. We are going to be picking up where we left off on Tuesday. So we covered the muscles of the spine and torso. Today, we're going to get started with muscles of the head, neck, and face. If you do not already have your trail guide, run grab it real quick. You will need it. We are opening up to page 224 and 225. It is the page that looks just like this. And just like our previous lecture, I will basically be running this lecture the same way as I did last time. So I will be using this beautiful trail guide slideshow, which is already posted onto MindTap. So you guys have the slideshow that I'm looking for, or that I'm using. So you guys will have all the material that I can give to you guys. All right, so let's start out with a general topographic view. We're just going to look at what can we see when we look at the human face. So looking here, we have the bone temporalis, or the muscle temporalis. So the temporalis muscle is a thin, flat muscle kind of located on the side of the head. We have the zygomatic arch. This is the fancy medical name for your cheekbones. So when you're putting on your blush, they still call it blush, right? When you put on your blush, that's where you're aiming for, this zygomatic arch. We can see the condyle of the mandible. You can feel it kind of just inferior and posterior to the zygomatic arch. You'll know your fingers are on the right place when you open and close your mouth. And you will feel this bony ridge kind of swelling and shrinking underneath your fingers. The nasolabial fold, naso means nose, labi refers to lip. So the nose lip fold, it's kind of like when you smile real wide, you got this line coming down here. The masseter is one of the chewing muscles. Find the side of your jaw, use about 2 fingers, and then press in and then clench your jaw. You'll feel this muscle kind of tense up under your 2 fingers. It's about 2 to 3 fingers wide, depending on the size of your jaw. Then we have the corner of the mouth. That is the corner of your mouth. I know, mine's blown. The sternocleidomastoid is a very important muscle. It is this prominent, thick, rope-like muscle running from the back of the ear down to the sternum. Very easily palpated. Upper trapezius, for my fellow Star Trek fans, that's where the Vulcan neck pinch goes, right around this thick, ropey, where you can see it, this thick, ropey muscle running right along the top of the shoulder. Scalenes, smaller muscles, you can kind of see some of them here off to the side, just a little bit. And then the clavicle, your collarbone, easily palpated. Right there, there's mine, right there. We have the glabella, which is one of my favorite words. The glabella is simply this space here between the eyebrows. For my energy peeps, it's where your third eye would be. The glabella is the bony landmark term for that piece of the skull, just that little section right between and above the eyes, the glabella. The nasal ala, ala means wing. So the wing of the nose is your nostrils. You'll see them when you flare your nostrils. That's the nasal ala. Next we have the philtrum. The philtrum is that little gutter that runs between your nose and the top of the lips, that little depression right through there, the philtrum. We have the base of the mandible, this pointy part right at the base of your chin. The hyoid bone, the only bone in the body that does not form a joint with any other bone. This one is kind of a U shape or a horseshoe, that's a hard word to say, horseshoe shape. By the way, guys, I have some special guests in here with me today. Give me just a minute, let me turn my camera around. Look who we have joining us.
Hi.
You guys are going to be seeing a little more of them. They're going to be taking over some of my lectures next week, so you guys will get a chance to hang out with some of your favorite Sun State staff. It's going to be a lot of fun. The hyoid bone sits right just superior to your voice box. So if you kind of pinch the sides of your throat, it's a little squishy, and then eventually you'll hit right around here, kind of a hard bony ridge running all the way across. Not the most comfortable thing to be squeezing around on, but an important bone and an important landmark nonetheless. Just inferior to the hyoid bone, we have the thyroid cartilage. The thyroid cartilage, for my guys, that's your Adam's apple. That's where that is. And then lastly, we have the jugular notch. The jugular notch, you can see on me right here. It's the little depression right at the base of the neck. If you turn your finger downward and press down, you'll feel like a slight curved ridge of bone. That is the jugular notch. All right, so moving quickly along, we are going to next look at the bones and bony landmarks of the head and face. We start out with the major bones of the skull. Generally, we divide these bones into two groups. We have the cranial bones and the facial bones. Cranial bones are all of the bones that create your brain case. These are all the bones that touch the brain. The facial bones are, well, facial bones. So everything from like the eyebrows down, anything that is connected to the skull but isn't touching the brain. So right in front, we have the frontal bone. This is the bone that forms your forehead. It is bordered. It also contains like the ceiling of your eye orbits. So this bone continues all the way into the eye socket, crossing the bridge of the nose, and then borders the parietal bones right at the coronal suture. Along the sides of your head, like where you would wear your earmuffs, we have the temporal bone. The temporal bone gets its name from the Latin word tempus, which means time, because it is upon the temples that the ravages of time first start becoming apparent, right? The little crow's feet lines, a few little grays here and there. I have more than a few myself, but I can't wait for quarantine to end so I can get these babies covered up. We are all of us are like working in a hair school and still can't get our hair cut or hair color, and it's driving us crazy. All right, next. So in between the eyes, but further back. So you wouldn't be able to put your finger on this bone unless you like shoved your finger in between the eyeball and the eye socket, which is really uncomfortable. I do not recommend it. We have the ethmoid bone. The ethmoid bone. It forms the ceiling of your nasal cavity. It has special passages for your olfactory nerves to kind of dangle down into the air so that as you inhale chemicals, those chemicals trigger the nerve receptors and it gives you your sense of smell. So this ethmoid bone is about this big and it sits right in between your nasal cavity and the floor of your cranial cavity. Now, one that is a little easier to touch on yourself is the lacrimal bone. The word lacrima refers to tears. So this is the bone, it has a groove in it, which sits your lacrimal gland, your tear glands. This bone is more anterior on the eye orbit. It's gonna be located right in the corner of the eye. If you just gently push slightly past the eye, you'll feel like a hard lump. That hard lump is the lacrimal gland. It is resting in a groove over the lacrimal bone. The next bone down is the maxilla. This is your face bone. So the maxilla begins along the lateral sides of the nose. It contains the floor of your eye orbits, and it joins with the zygomatic bone right about the midline of your eyeball. So if you draw a straight line down from your eyes, that's roughly where this joint would be. I'm trying to remember the name of this joint. I want to say it's the maxillozygomatic joint or lacrimomaximal. It's something like that. They're going to combine the names of the two bones. It's just, I can't remember right off the top of my head. Anyway, not important. What is important is that your maxilla starts out its life in two pieces, a left and a right. By the time you reach early to mid 20s, this suture has fused and now you are left with one solid maxilla. So again, lateral sides of the nose, ceiling of the eye orbits, all the way to the zygomatic arch, and then down, and it contains the entire upper row of teeth. Along the side of the skulls, we have the parietal bones. You can only see this bone here, but I just want you to understand the bone is more located up here. When we think about the parietal region, we're usually thinking around the top of the skull. It's just that you can only see a little piece of this bone from the anterior view right here along the side. The next one we have is the sphenoid bone. The sphenoid bone is one large bone. It's shaped kind of like a butterfly. The edge of the sphenoid is visible here on the temple. It also creates the posterior wall of your eye orbit, as well as about half of, follow me here, half of the anterior floor of your cranial cavity. So the front half of the brain is actually resting on the sphenoid bone. It goes all the way across. So you can see a piece of the sphenoid here. It is one bone. It goes all the way across, creating both of the posterior walls of the eye orbits and the anterior floor of your brain case of the cranium. Next, we have our two little nasal bones. These are very small, very thin bones. They are paired, so there's a left one and a right one. And these are the bones that form the bridge of your nose. So if anyone has ever broken their nose before, these are the bones that you most likely broke. So these only extend almost halfway down the bridge of the nose. So your nasal bones start up here and then they will end roughly about here. The rest of this is going to be cartilage. The next bone we have is the zygomatic bone. This is your cheekbone. So this is it. So if you put your fingers right on the cheekbone under your eyes, you're still on the maxilla. We're going to move laterally just slightly. Once you've moved about past that midline of your eyeball, now you are on the zygomatic bone. And this one will reach all the way around, and zygomatic bone reaches around and blends into the temporal bone. It has a joint right in front of the ear with the temporal bone. The vomer bone is it's a single, very flat bone, kind of plow-shaped. It only looks like a little stick right here, but that's because it's facing you. If you turn the bone to the side, it's a little bit wider, shaped like a plow. But the vomer bone separates your left and right nostrils. So it's a hard, bony wall that divides your nasal cavity into two. The final bone is the mandible. This is your jaw bone. The mandible forms a joint with the temporal bone on both sides, and it contains your entire lower row of teeth. All right, good stuff so far? I get thumbs up. That's all good stuff. All right, turning around to the posterior view now, we have prominently right at the top the sagittal suture, which forms the joint between your left and right parietal bones, which brings me naturally to parietal bones. Then in the back, we have the occiput, also known as the occipital bone. These two words are the same thing. The occipital bone forms the posterior wall of your cranium, as well as the posterior floor of your brain case. So the front of the brain is resting on the sphenoid. The posterior aspect of the brain is resting on the occipital bone. On the occipital bone, we have a prominent bump, a very, very prominent bump, which is resting kind of along a raised ridge of bone. This ridge is known as the superior nuchal line. It is named after the nuchal ligaments which attach there, connecting the occipital bone to some of your cervical vertebrae. The word nuchal refers to neck, just what that means. And anytime we see a directional term like superior, understand we are implying the existence of an inferior nuchal line. The inferior nuchal line would run right about here. It isn't labeled, but it does exist. That is why we threw superior in here. The bump, which you can easily feel on yourself. Guys, you'll have a little bit easier time finding this. This is a bony landmark that is much more prominent in males than in females, but everybody will have one. Right on the back of the head, down towards the base of the skull. If you kind of poke around there, you will feel a very prominent bump. That is the external occipital protuberance. Protuberance is a very fancy word. It means bump. So we have the external occipital bump. Coming on around, you are seeing the mandible. You are just looking at the posterior aspect of the mandible. So you're looking from the back inside the mouth. You can see the back of your teeth. We've got the back side of the maxilla here. And then right behind the ear, just posterior to the ear, we have another very large, prominent bony bump. This one is known as the mastoid process. So it's very easy to find. It's a very large bony bump running right behind the ear. You'll feel how it kind of comes down to a sharp point. That's how you'll know you're on the right one. The mastoid process is a process extending off of the temporal bone. So we can see the temporal bone here on the side. And then the last landmark to name is this suture that connects the occipital bone to your left and right parietal bones. It is known as the lambdoid suture. This is a Greek word. Anytime you see this ending oid, that is a Greek suffix. Oid is our science speak for ish. It's of or resembling something. Now, what does this resemble? The Greek letter lambda, which looks kind of like a triangle without a bottom piece. So just an inverted V, that is the Greek letter lambda. There we have the lambdoid suture because it kind of resembles the Greek letter lambda. So, your trail guide then goes into palpation trails, right? That's why they call it the trail guide. They give you trails to palpate. We're gonna move past those. Remember, the slides are available to you guys on MindTap. All of this information is also in your trail guide book. So I highly recommend you guys like take the trail guide and kind of work your way around your skull, palpating these features. This is something that I would do in a live class, but since we're all online, I will just throw all this information online for you. Oh, there's the sphenoid. There's the sphenoid, butterfly shaped. Yep, good picture. All right, so we're moving on past our palpation trails. We are going to pick up on page 240. So on page 240, you guys will see this illustration. This is generally labeling some of the more important muscles of the head, neck, and face. The ones in red are the ones that we are going to be covering today. These ones that are grayed out are ones that we have previously covered, I do believe. So let's start at the top looking at this muscle, the frontalis. Like you guys have seen over and over with anatomy, right? We've got the frontal region, we have the frontal bone. In the brain, we have the frontal lobe. Now, when we look at the muscular system, we have the frontalis muscle. Again, these names are often trying to clue you in as to where they are or what they are doing. The frontalis muscle is the muscle responsible for the look of surprise. So when you raise your eyebrows and wrinkle your forehead, that is the frontalis muscle contracting, lifting up on the eyebrows. It blends into a thin sheet-like tendon. Remember, tendons that are shaped like flat sheets of paper are known as aponeuroses. This particular aponeurosis is known as the Galea aponeurotica, which is a really, really fancy word. I really love saying that one. You may also see this one referred to as the epicranial aponeurosis. It is the aponeurosis upon the cranium. So 2 names, welcome to anatomy. Everything has 5 different names. Now, the frontalis muscle turns into this aponeurosis, and then another muscle emerges on the posterior side. This is known as the occipitalis muscle. If we are naming each of these individually, we have the frontalis and the occipitalis. We could also combine these to refer to this one entire structure. We would just stick the names together, the occipitofrontalis muscle. Right along the lateral side of the skull, we have our temporalis muscle, named because it sits over the temporal bone. These fibers that run, some of these run at an angle, some of these run up and down. Remember what I told you last time. If you are looking at a muscle And we have muscle fibers that are running in two separate directions. These are more vertical, these are more oblique. Separate muscle direction gives you separate muscle actions, okay? So just like we saw last time, muscles that run up and down tend to flex, right? In this instance, these muscles, this muscle runs down, tucks behind the zygomatic arch, or deep to the zygomatic arch, and then inserts onto the mandible. So these vertical fibers, when they contract, they lift the mandible upwards, right, into elevation, closing the mouth. But these posterior kind of oblique fibers pull the mandible posteriorly, retracting the jaw, kind of giving you an overbite. So we can move the jaw in multiple directions using this one muscle because it has muscle fibers that run in various directions. Next one we're going to look at is the masseter. This is the main chewing muscle of your body, and relative to size, this is the strongest muscle in your body. You can get about 150 pounds of biting force between your two masseters. Now, it isn't the strongest because it's such a small one, but if we were to take this muscle and blow it up to the same size as a glute maximus or a latissimus dorsi or a bicep or a quadricep muscle, it would by far be the strongest muscle in your body. So relative to size, this is the stronger one. The masseter begins on the inferior margin of your zygomatic arch and then inserts along this broad, flat area of the mandible known as the ramus. So when this muscle contracts, again, it lifts up on the mandible, closing the mouth. This is why it is one of your chewing muscles. It's also where it gets its name, masseter. It's named after mastication, chewing. All right, the digastric muscle, di meaning two, gaster or gastro referring to a stomach or a belly. This is a double-bellied muscle. It's two bellies of muscle with a little bit of tendon right in the middle. So the anterior belly runs from the posterior aspect of the mandible to this hoop-like tendon that wraps around the hyoid bone. So that is where the central tendon is, and then the posterior belly runs from that central tendon back into, here's the posterior belly. So this looks like it's going to run all the way back to the occipital bone. This is going to be a mandibular retractor. So it's going to help with pulling the mandible posteriorly. Thyrohyoid runs from the hyoid down to the thyroid gland. Omohyoid, this is a tricky one. Omohyoid, okay. Omo is Greek, it means shoulder. The omohyoid runs from the hyoid bone to the scapula. It actually inserts onto the superior notch of the scapula. Now, you wouldn't really think that you would have a muscle connecting your hyoid bone down to your scapula, but in fact you do. It is an important muscle, and it's one I like to use as my tricky, my trick answer when we're covering the scapula. There are 16 muscles that attach to the scapula. 15 of them we cover when we do the scapula, right? Everybody knows like our 4 rotator cuff muscles, and you've got teres minor, teres major, you've got serratus anterior. There's like 16 muscles that all attach to the scapula. The 16th one that trips up a lot of students is this omohyoid, running from the hyoid down to the superior notch. Sternohyoid, again, running from the sternum, from the hyoid to the sternum. And then we have the sternocleidomastoid. Cleido means clavicle. It's the word for clavicle. So sternocleidomastoid tells you the 3 attachments of this muscle. Sternum, clavicle, starts in 2 separate bellies. These bellies merge into one. The one belly inserts onto the mastoid process. The sternocleidomastoid is one of the weird muscles that doesn't follow the usual rule that the origin is superior and the insertion is inferior. For this muscle, its origin is down below and it reaches up to its insertion at the mastoid process. Remember, what defines the origin? It will always be the more stable or the least movable of the 2 attachment sites. So when you look at the sternum and the clavicle versus the mastoid process, you get a lot more movement up here than you get down here. So this is the more stable. That is why this one is the origin of the SCM. All right. We can see the upper trapezius kind of draped over. We also see levator scapula and splenius capitis. We covered those when we did the muscles on the last section, or you covered them when you did arm and shoulder muscles. So I'm going to move right along. All right, so the first muscle that we are going to look at today is the sternocleidomastoid, or SCM. The sternocleidomastoid is located on the anterior lateral sides of the neck. It is a very prominent muscle. When someone turns their head, you can't help but see this thick, ropey muscle emerge from the surface of the neck. It has two heads. Again, the sternal head and the clavicular head. These two bellies merge into one single belly, which then inserts onto the mastoid process. I want you to highlight in the text under sternocleidomastoid, right around the middle of the paragraph, highlight the carotid artery passes, I lost my place, sorry. The carotid artery passes deep and medial to the SCM. The external jugular vein also lies superficial to it. The SCM is also superficial, completely accessible, and often visible when the head is turned to the side in Lord Byron-like fashion. You got an illustration of Lord Byron. He was an old poet back in the day. So in one of the more famous pictures of him, he's got his head turned, and that SCM is just sticking straight out. So look at this muscle. Look at where it is. We see that its fibers run in an oblique fashion. We said in our last lecture, muscles that run in an oblique angle will tend to cause some kind of rotational movement. It's exactly what we see with the sternocleidomastoid. Also, it does run vertically, right? Not perfectly, but it does run vertically, which means it will assist with some kind of flexion or extension. In this case, it's on the front. It does flexion. So because it is on the front of the neck, it is a flexor. Because it runs at an angle, it is also a rotator. Now this one, if we want to make sure that we are clear about why this muscle's origins and insertions are reversed, if you start an anatomical position, I'm going to turn this way. Start an anatomical position, put your finger on the origin and your finger on the insertion. Now look at how far your fingers are from each other. For me, that's about 10 inches or so. Now, when this muscle contracts, when it shortens, it pulls its insertion toward the origin, and that is closer to about 8 inches. So the muscle does shorten, but when it shortens, it pulls the head into a rotation. Now let's keep going with this. When it pulls the head into a rotation, on my right side, my right SCM contracts, my head rotates to the left. So it rotates to the opposite side from the muscle that did the contracting. This is known as a contralateral rotation. Contralateral means to the opposite side. If one of these muscles contracts, just one, it will pull the ear down toward the shoulder, creating lateral flexion. I gotta get my hands on straight. Lateral flexion. It also causes contralateral rotation, one-sided when one side contracts. If both sides contract, they pull both ears down towards the shoulder. That is neck flexion. Right? Bilaterally, we get neck flexion. Unilaterally, words are hard this morning, you guys. I must not be up on my coffee yet. Bilaterally, we get neck flexion. Unilaterally, we get lateral flexion or contralateral rotation, rotation to the opposite side from the muscle that is doing the contracting. Now, because it does insert onto the sternum, it will also, to some degree, assist if you have a forced inhalation. It will assist with lifting up on the ribs. But the main actions that I want you guys to be aware of are these first three: lateral flexion, rotation, and neck flexion, anterior flexion. I also need you to know the origins and insertions of this muscle. For sure, you will need to know these. Remember, I wasn't particular about origin and insertions for the lesser muscles. SCM is not a lesser muscle. If you have clients that have computer jobs or driving jobs, or they have a lot of neck pain or headaches, sternocleidomastoid is one that you're going to want to focus on. You've got to be able to identify where this muscle begins and ends. So origin is going to be on the top of the manubrium of the sternum, as well as the medial third or so of the clavicle. So if you take your collarbone all the way, you're going to look at about the first third of it. And then the insertion is on the mastoid process, just posterior to the ear. So when would you use your sternocleidomastoid? Well, since it causes contralateral rotation, anytime I tell somebody, no, I am not doing that for you. No, no, no. Shaking your head no creates contractions in the sternocleidomastoid. Also, shaking your head yes, right? That anterior neck flexion as you move the head up and down. Whenever you're riding a roller coaster, this muscle will engage to keep the head stabilized. So as their body is moving around, the head remains stable, contracting, like little small contractions to help keep stabilization in the neck. And also cocking your head to hear what someone is saying. You ever made a noise or something, your dog looks at you and your dog is like, whoa, 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 lateral flexion. One more little tidbit, because we do have the carotid artery running just deep to this muscle and the external jugular vein running just superficial to this muscle. If you are working on the SCM on a client, you only want to work on one at a time. If you work on both at the same time, you could cut off blood flow to the brain, and that would be like really bad. So you turn the head to one side, you work on one side, and you turn the head over and work on the other side. You work on them one at a time. All right. I know I am moving rather quickly, you guys, but remember this slideshow is on MindTap. This lecture is being recorded and it will be posted to MindTap later this afternoon. So you can always like pause and rewind and just listen to my lovely voice go over this stuff over and over and over again. All right, next muscle group are the scalenes. There are 3 scalenes in this muscle group. We name them based on their position. So we have the anterior scalene, the middle, and the posterior scalene. These muscles will begin along the transverse processes of some of your cervical vertebrae, and they will insert onto either the first or second rib. So if we have a muscle running from the cervical spine to a rib, it is most likely going to be a rib elevator, right? It's going to lift up on the rib cage. Because they are attached to the cervical spine and they kind of run at an angle, they are going to be involved in some kind of neck rotation. Again, we can start to develop an intuition about muscles just by looking at the direction of the fibers, where they fit on the skeleton, are they front or back? Are they lateral or medial? Remember, it's not very efficient to try to memorize all of this information. The better option is to learn the general rules that muscles will follow based on muscle fiber direction and general positioning on the body. And then you can start to infer or take really good guesses to what these muscles will do. 9 times out of 10, your guesses will be correct. So when one of these muscles contracts, let me go back to this image. When one of these muscles contracts, we see that these are running at an angle. So this tells me oblique muscle fibers, rotation. Because they are attached to the neck, from the neck to the ribs, when this contracts, it could also pull the neck down towards the ribs. This would be lateral flexion. So we get lateral flexion, there's one action. We get neck rotation, there's a second action. And the third action, if they both sides contract together, we could elevate the ribs, lifting the ribs up towards the neck, or we could flex the neck forward. Now, the only one of these that is going to be doing any of that neck flexion is going to be the anterior scalene. The other two are simply not positioned correctly in order to create flexion, but we will get some flexion from the anterior scalene when it contracts bilaterally. So at the top of the page, we are on page 246. I do want you to highlight the very first sentence. The three scalenes are sandwiched between the sternocleidomastoid and the anterior flap of the trapezius on the anterior lateral neck. Pause highlighting there. Their fibers begin at the sides of the cervical vertebrae. They dive underneath the clavicle and attach to the first and second ribs. During normal inhalation, the scalenes perform the vital task of elevating the upper ribs. I'm going to skip a little bit. Due to their small size and varied location, the posterior scalene can be difficult to distinguish from surrounding bellies, so you may not be able to feel each one of these muscles. The large branches of the brachial plexus. Now, brachial tells you arm, so something is on its way down to the arm. Plexus tells me nerve, a bundle of nerves. You can see the brachial plexus here in yellow. It comes out between the anterior and middle scalenes. This is the one that is responsible for thoracic outlet syndrome. Thoracic outlet is a common nerve disorder. It's created by the impingement of the brachial plexus, usually by the scalene muscles. It begins in symptoms with numbness and tingling in the fingers. This is common in professions like landscapers or electricians, people who work with their arms up above their head all day. So if you're an electrician and you're doing electrical work up here, by lifting up those shoulders, you contract these muscles, just like your bicep. When muscles contract, they get shorter and they get wider. That increase in their girth creates pressure on the brachial plexus, which will then send pain signals all the way down the arm. You start out with synesthesia, that numb pins and needles feeling in your fingers. It will slowly start to spread up the arm as it gets worse. Eventually, your whole arm just feels like it's gone to sleep, numb, bloated. Oftentimes, people will wake up like this. If you're a side sleeper, right, and you sleep with one shoulder like jacked up, you're creating pressure on this brachial plexus. So I also want you to highlight the last sentence in this section. Highlight, individual nerves of the brachial plexus may penetrate through or in front of the anterior scalene. So you may get a few, just remember guys, there's a lot of biological variation amongst different people. Textbooks will tell you one way, but in practice, everybody's body is a little bit different from one person to the next. So it's not uncommon that some of these nerves may have slipped out and became, when I say slipped, this happens in utero, like when everything's being developed, it's nothing you did. But some of these nerves could be passing in front of the anterior scalene. There is a lot of genetic variation among humans. So for all scalenes, I want you to know their origins and insertions. Anterior scalene and middle scalenes are in the upper cervical spine on the transverse processes of C3 through 6 or C2 through 7. Those two insert on the first rib. Posterior scalene originates on the transverse processes of C6 and C7 and insert on the second rib. Please make sure you also have the actions highlighted for these muscles. When they all contract unilaterally, we get lateral flexion and contralateral rotation, rotation to the opposite side of the side that is doing the contracting. When these muscles contract bilaterally, we get rib elevation, like when you're going through forced inhalation. Good example of forced inhalation, let's say you're in a swimming pool and you've been holding your breath underwater, right? And you start to reach that critical point, you swim up to the top, your head breaks the surface, you take a sudden, quick, deep breath. Notice how the ribs elevate. They also flex the head and neck, but we are only talking about the anterior scalene here. Only the anterior scalene does anterior flexion. All right. As always, you guys, shout out if you have any questions. If I'm moving too fast, stop me. I'm just going to keep moving forward. The next muscle on our agenda is the masseter. I want you to highlight the entire first paragraph on this page. The masseter is the strongest muscle in the body relative to its size. Relative to its size. The two masseters together exert a biting force of nearly 150 pounds of pressure. That is enough to bite off a finger. Do not try that at home. The masseter is the primary chewing muscle and is used in speaking and in swallowing. This muscle is pretty straightforward enough to get to. You want to start by finding the angle of the mandible. You'll find where your jaw comes to this natural curve. 2 fingers, if you're a largely built person, maybe 3 fingers you'll need. But just anterior to this angle of the mandible, you'll put 2 fingers right there. You will know you're on the right spot. When you clench and unclench your jaw, you will feel this muscle bulging as it contracts. So this muscle is going to be about that big, right? About 2 fingers wide and about 2/3 of the length of your finger. Now, let's look at this muscle. We see slightly oblique fibers. Its origin is along the inferior margin of the zygomatic arch. Its insertion is the entire ramus of the mandible. Your book tells you that there are 2 separate bellies kind of sandwiched together in one muscle. I respectfully disagree with your book. I have seen human mandibles where you can see the attachment sites. There are 3 bellies to the masseter muscle, but I'll just leave that one alone. You've got the superficial belly and the deep belly. There is also a tertiary belly to the masseter muscle. Just throwing that out there. But, all right, so with the origin up here and the insertion down here, when this muscle contracts, it is going to elevate the mandible, closing your mouth. But because of these oblique angles, we could also contract and pull the mandible forward slightly in place. Pushing the mandible forward is known as protraction, which gives you kind of an underbite. Like an underbite. There's a famous Family Guy character with the it's a really funny character. Anyway, so there are the 2 actions. Again, memorization is not the way to go when you're talking about muscles. Use these tips and tricks. Muscles follow rules. If you learn the rules, you can figure out what the muscle does just by looking at a picture of it, right? The muscle runs up and down, it's going to be an elevator. The muscle runs at an angle, it's going to pull the insertion back here towards its origin up here. So when we move it forward, we move the jaw into protraction. Protraction like an underbite. Yes, thank you, Lorianne. Lorianne reminded you guys, this is a really good muscle to focus on if someone has TMJD, like they have jaw issues with the jaw joint. This is a really good one to work out because the jaw joint is located right here. So if there's an issue in this joint, by working out the muscle that is holding 2 of these bones together, we can relieve some of the pressure and restore some of the mobility to the jaw. So when do you use your masseter? Talking, gabbing, chin wagging, chewing the fat, right? Just shooting the breeze. Chomping down on a wad of gum. Every time you clench your jaw down, you're contracting that muscle. And gnashing your teeth together during an argument, which I don't argue that way, so I can't tell you that from personal experience, but I'll take their word for it.
Growl at your spouse.
You growl at your spouse. Yeah, and here's my thing. So they list here, you've got the deep belly insertion and the superficial belly insertion, but there is a 3rd belly to the masseter right here. Yeah, there's 3 bellies. Well, nobody would unless you dissected it, but when I was working in the bone lab, you would see, it was faint, right? Because it's still a ramus, it's still flat, but you could see very, very faint ridges where the muscle plugs into that bone, and there's markings for 3 bellies. Maybe it's one of those genetic variation things where some people develop 2 and some people develop 3, because that kind of thing happens a lot.
Or almost like 2 heads of one of the bellies
Yeah.
coming down or something.
Yeah, they're there are several muscles in the body. A good notable one is the peroneus muscle. We learn about peroneus longus and brevis. Some people develop a third peroneal muscle called the peroneus tertius. I think it's very rare, but some people develop a third head of the bicep muscle. There's a lot of variation among human
Tertiary
beings.
means accessory.
Third. Tertiary means third.
Third?
Mhm. I don't know if it's Latin or Greek, but tetra means three.
That makes sense.
Yeah, tetra is
Alright.
three. All right, next muscle we're gonna look at is temporalis. Now the temporalis muscle is another one that is easy to palpate on yourself. Using the pads of your fingers, place your fingers around your ear, right? Not on the ear, not on the ear, just around the ear. And now clench your jaw and you'll feel this muscle kind of contracting. You guys ever seen a bald guy chewing? You see a bald guy chewing, you see this muscle way up in his head contracting? That's the temporalis. That's the muscle that you're seeing. So the temporalis muscle is located on the temporal aspect of the cranium. Its broad origin attaches to the frontal and parietal and temporal bones. Its fibers converge in a thick mass, which reaches under or deep to the zygomatic arch and inserts onto the coronoid process of the mandible. So it completely covers the sphenoid bone, but it doesn't attach to the sphenoid, right? It just sits on top of it. We have origin attachments along the frontal, parietal, and temporal bones. These muscle fibers converge like a big funnel and then insert on the tip of the coronoid process of the mandible. So again, looking at the positioning of this muscle, the anterior fibers are arranged more vertically. Those are going to be jaw elevators. So they're going to assist with closing the mouth. These posterior fibers are much more oblique. So when they come in at an angle and hit the coronoid process, they are going to pull the mandible posteriorly. This is antagonistic to the masseter, right? Masseter pulled the jaw forward. Temporalis pulls the jaw backward into retrusion. So to retrude your jaw, it's hard to do, but you pull the jaw back so you have like an overbite, right? You pull the jaw hard and then you pull the jaw backward. It's hard to talk when you're doing that, but so we have two actions based on the two arrangements of their muscle fibers. We have elevation and we have retrusion or retraction. The trail guide is funny. So when do you use your temporalis muscle? When you're ripping off a piece of beef jerky, when you're chewing that piece of beef jerky, and when you're grinding your teeth while you sleep, dreaming about beef jerky. I swear to God. Oh yeah, unless you're a vegan like Christina, and then what do you, like kale? You dream about kale? I'm from the South. Kale is a garnish. It is not something you actually eat. You like put a leaf on the plate and it looks pretty and you throw it away when you're done.
Collards.
Collards. Oh, I'll eat the heck out of some collards. Oh, they're so good. All right, the next muscles we have are the suprahyoids and the digastric. Now, again, pay attention to what the names of the muscles tell you because they are cluing you in on something. Supra, as in superior, above, or superior to, hyoid. I'll give you three guesses where we are going to find this muscle. Go ahead, I'll wait. If you said that the suprahyoid muscle is going to be located superior to the hyoid, congratulations, you did that correctly. Now the suprahyoids are a group of muscles. There are multiple muscles in this group. We have the geniohyoid, we have the stylohyoid, we have the mylohyoid. We got this cool tendinous sling, like a little strip of tendon that loops back, holding some of the bellies in place, particularly the belly of the digastric. Di means two, gaster or gastro means belly. So the digastric is a two-bellied muscle connected with a little piece of tendon right in the middle. All right, so the suprahyoids, geniohyoid, mylohyoid, and stylohyoid form a wall of muscle along the underside of the jaw. So if you tense up the muscles in your jaw and then push in, you will feel this thick, sturdy wall all the way under your chin. Those are the suprahyoids. They stretch from the edge of the mandible to the hyoid bone. They lie inferior to the glossus muscles, which are the muscles of your tongue. So that word glossus, or if you see that word part anywhere, glossopharyngeal, that's referring to the tongue. So even though the three suprahyoids are quite small, collectively, they affect the tongue and hyoid bone and are important in chewing, swallowing, and speaking. They are partially deep to the digastric muscle, yet accessible. The suprahyoid bellies cannot be individually distinguished. You can feel the suprahyoids, but you can't determine which one you're really on. They just kind of blend together. I want you to highlight the first sentence in the third paragraph on page 253. The sentence says, the long, round digastric muscle is composed of a posterior and an anterior belly. So here is a beautiful image right here, starting on the posterior aspect of the base of the mandible. So if you put your thumb kind of behind and underneath your chin, we start there. The anterior belly runs from the posterior mandible to the hyoid. Here is the bit of tendon that is caught under that tendinous sling. So we hold the tendon in place so it can slide forward and backward, but it stays attached to the hyoid bone based on this tendinous sling. Then we come to the posterior belly. Posterior belly runs from the hyoid to the mastoid process. So again, looking at this muscle, we've got fibers that are running in this direction. The larger portion is here. So when this part contracts, we pull the mandible backwards. This is going to assist with retrusion of the scapula. So looking at the suprahyoids, the actions that we see, the suprahyoids will elevate the hyoid and tongue. So if you put your fingers on your voice box, right, on either side, nice and gentle, and then swallow. You will feel it rises up and then drops back down. That elevation that goes along with swallowing is the responsibility of the suprahyoids. So elevate the hyoid and tongue and depress the mandible. So depress the mandible, we turn the hyoid into the origin and pull down. Or we turn the mandible into the origin and pull up on the hyoid. I want you to make sure you've highlighted the two actions of the suprahyoids, and then I want you to highlight the first action under digastric. The primary action, when we fix the hyoid bone in place, it depresses the mandible, pulling down on the mandible. But if we fix the mandible, then it will assist with elevation of the hyoid bone. So it just depends on which bone is doing the moving. And then lastly, we have retract the mandible, which is the one action that we could intuitively guess from this muscle, right? It pulls the mandible posteriorly. All right, so after we cover the suprahyoids, the next group are our infrahyoids. These sit inferior to the hyoid bone, attaching to the sternal head of the clavicle, as well as the manubrium. And then we've got this one long muscle going posterior to the clavicle. We kind of faded it out, but it ends up inserting on the scapula, right at the superior border of the scapula, right around the superior angle. Or no, not superior angle. I want to say it's the superior notch. I'm pretty certain it's the superior notch of the scapula, not the superior angle. All right, infrahyoids are located on the anterior neck, superficial to the trachea. All four muscles are thin and delicate, and they function as antagonists to the suprahyoid. So if the suprahyoid was pulling up, the infrahyoids will pull down. The superficial sternohyoid and sternothyroid are layered just to the outside of the trachea, and although difficult to distinguish individually, they are directly accessible. Deep to these two muscles is the thyrohyoid. As its name suggests, it spans from the thyroid cartilage to the hyoid bone. The omohyoid is perhaps the most bizarre muscle in the body. It has a skinny, ribbon-like belly running from the hyoid bone, passing underneath the SCM, underneath the scalenes, all the way down to the scapula. Aside from depressing the hyoid, the omohyoid tightens the fascia of the neck and dilates the internal jugular vein, but because of its depth and its slender belly, this muscle is largely inaccessible. The one thing I mainly want you to take away from the infrahyoids is this action. They depress the hyoid bone and thyroid cartilage. So if the suprahyoids are elevating the hyoid bone, the infrahyoids depress the hyoid. The next muscle on our list is the platysma, everybody's favorite muscle. The platysma is a very unique muscle. When we talk about skeletal muscles, we are generally talking about muscles that originate and insert onto bony landmarks. The platysma does not really follow this rule. It begins in fascia around the mouth and chin. It sweeps across the anterior neck, but its insertion, it just kind of blends into the fascia surrounding the upper pec muscle, the pec major. So it doesn't really have established bony landmarks. So it kind of originates around the mouth and jaw and then blends into the fascia of the upper chest. I do want you to highlight the first sentence here. The platysma is a thin, superficial sheath spanning the anterior neck from the mandible to the chest. And the best way to visualize the platysma muscle is to do the Swamp Thing face, which looks something like this. Ooh. And there's the platysma all the way across. So you can see where it's originating around the mouth and on the chin. And then if you kind of feel these fibers as we go down, somewhere around the clavicle, you kind of lose them. They just kind of flatten out and merge with the rest of the tissue. So these guys assist to depress the mandible. They assist with pulling it down. And they also tighten the fascia of the neck, which is what I just did. This thing right here. Ooh. That's the only highlight that I have for you for the platysma. So we are going to move swiftly along. The next muscle, we are on page 258, is the occipitofrontalis. The occipitofrontalis is another unique muscle. We have two bellies on the ends and then an aponeurosis in the middle. Now again, this aponeurosis goes by two separate names. They are referring to the same thing. We just have two different names for them. Welcome to anatomy. The Galea aponeurotica. It's a really fancy name for it. You may also hear it called the epicranial aponeurosis, the aponeurosis that is upon the cranium. The belly of the frontalis sits in front over the frontal bone. The occipitalis sits on the posterior side over the occipital bone. Now, occipitalis is a little difficult to feel it do anything, but the frontalis muscle is easily palpated and its action is very visible. It elevates the eyebrows, giving you this woo kind of expression. Woo. The occipitofrontalis is the muscle primarily responsible for raising the forehead into an expression of surprise. This is my shocked face. Highlight. It is a unique muscle with four thin bellies, two frontalis bellies located on the forehead and two occipitalis bellies located on the back of the head. Stop highlighting there. The four bellies are joined by the Galea aponeurotica, a broad sheath of connective tissue stretching across the top of the cranium. Although the occipitofrontalis is superficial, its fibers cannot be isolated. So you can see what it does, you can feel the bellies, but you can't really feel the individual fibers. I want you to highlight the actions of this muscle. So the frontalis raises the eyebrows and wrinkles the forehead. The occipitalis anchors the galea aponeurotica and retracts it posteriorly. So this one is going to be really hard to see, but if you are able to do this, you'll know when you contract this muscle, it pulls everything backwards. So you may get a slight contraction that kind of pulls your hairline and your ears back. I know this is going to be difficult to see, but try to watch like around the hairline and around my ears. You guys see that very slight amount of movement. It is very slight. And I don't know what your quality of your webcam is. You may not have been able to see it. But when you contract the occipitalis muscle, you get a very, very slight retraction of the scalp and the ears. Everything just wiggles a little bit. All right, so if you have the two actions highlighted, when do you use your occipitofrontalis? Raising your eyebrows in an expression of surprise, shocked face, and smiling and yawning. According to a study of 30 volunteers who allowed electrodes to measure their muscle activity, these muscles get involved when smiling or when yawning. So there you go.
Oh, you said the Y word.
I know. I said the Y word and now everybody in here is yawning. Sorry about your life. All right, moving on to the next page, we are looking at the medial and lateral pterygoids. This is a really interesting word. The P is silent, like in pterodactyl. Ptero, if I'm not much mistaken, I do believe that the word part pteri or ptero means wing. So a pterodactyl is like one of the big winged dinosaurs. These muscles are so named because they have kind of a narrow origin and a broader insertion, so they kind of wing out. The medial and lateral pterygoids assist masseter and temporalis with movements of the mandible. The medial pterygoid helps to elevate the mandible, while the lateral pterygoid protracts it, moving it anteriorly. The medial pterygoid is located on the interior side of the mandible. So you are not going to be able to palpate this muscle unless you put on a latex glove and you go into the client's mouth and start palpating around the outer jaw or the inner part of the cheek. Oh, Valeria, I just saw your question. Yes, the platysma is the most superficial of the neck. Yes. You're welcome. I was going to type that out for you, make sure you got it. Yes, platysma is most superficial on the anterior neck. Now, I know I almost put money on the fact none of you guys have ever put gloves on and gone poking around inside someone's mouth. Generally, that is not something that we do in massage. However, massage is a very broad field, and there is a place for almost everything within our profession. There are many therapists who work with dentists, and they are specifically trained to use massage techniques in order to treat or alleviate issues related to the TMJ, related to the jaw. If your client is holding their jaw in a protruded way, then we can do certain massage techniques. Again, when you go in someone's mouth, you got to put on a glove, and this is even pre-COVID. Like you always put on a glove before you go sticking your fingers in someone's mouth. But you would use your massage skills to massage like the internal part of the cheek. You like go between the jaw and the cheek. You would go up as well, and then you could pinch the cheek with your fingers on the outside, your thumb on the inside, and you roll these muscles, getting up as close to the joint as you can. It's not the most comfortable thing to have done to you in the world, but if they have TMJ, they are living in pain because of their jaw issues. Being able to massage these muscles and get some of that tension worked out and restore some mobility to the jaw will help reduce the pain, increase range of motion, thus alleviating some of the symptoms of TMJ. This is not something that I would just do if I was working at Hand and Stone or Massage Envy. This is a special form of massage that I would only be using if I was employed in a dentist's office, or I was otherwise working with an orthopedic doctor, someone who is focused on joint issues, particularly the TMJ joint. Now, the lateral pterygoid has more horizontal fibers, and these extend from the sphenoid bone to the joint capsule and the articular disc of the TMJ. Portions of the pterygoids can be accessed from both inside and outside the mouth. The better way to do it is going to be to go inside the mouth, though. This is not something that you guys will learn at Sun State. This is going to be a continuing education thing. You pay money and someone will teach you how to put on a glove and go trailing around in someone's mouth. Now the medial pterygoid is here. So we are looking at, where is this going to be? Pterygoid plate of the sphenoid bone. So this is sphenoid, and then inserting onto the interior aspect of the angle of the mandible. This is all medial pterygoid. Let me find a picture of the lateral. There's the lateral. So on the lateral view, we are looking at its origin kind of here on the sphenoid bone, and then inserting onto the condyle of the mandible. So origin is going to be the more stable, so it's going to be the larger one. Insertion is going to be smaller. So when this muscle contracts, it is going to contract this way, pulling the jaw anteriorly or protruding the jaw. Whereas this muscle, right, is going to lift upwards on the jaw, assisting with elevation of the mandible. But notice that these fibers also run at an angle. So when they contract, they will pull the jaw forward, also creating protraction, giving you an underbite. All right. So in your book, the only highlights that I have for you are the actions of these muscles. I don't have any highlights in the text. So please make sure that you have highlighted laterally deviate the mandible to the opposite side. When one contracts, it pulls the jaw to the opposite side of the side that is doing the contracting. Elevation of the mandible and protraction of the mandible. The lateral pterygoid also laterally deviates the jaw to the opposite side. So lateral deviation would look something like this. So when my jaw moves to my left, it is my right side that is doing the contracting. So the right side contracts, pulls to the left. When they contract bilaterally, it protrudes the jaw, giving you an underbite. All right. The last two muscles that we are going to look at here are the longus capitis and the longus colli muscles. I don't have any highlights on these pages, so I'm not going to spend a whole lot of time on these, but I do just want to point them out to you so that you're at least aware of their existence. Longus capitis runs from the occipital bone and then inserts onto the transverse processes of C3, 4, 5, and 6. Oh, look at that. It says it right there. This muscle, because it is on the anterior side, it will be a flexor. And because it attaches the, or because it runs in an oblique angle, it will assist with rotation as well. So we've got lateral flexion and rotation. The longus colli muscle does not touch the occipital bone. It begins on C1 and then kind of loops over itself to attach to all the various vertebrae down to 1, 2, 3, 4, 5, 6, 7, then T1, 2, 3. The first three transverse thoracic vertebrae. So again, this muscle is going to have pretty much the exact same actions though. It's going to assist with rotation of the neck, flexion, and then lateral flexion if only one side contracts. Again, no highlights for this page. So, all right. Before we move on to our next section, does anyone have any questions over anything that we have gone over so far this morning?
I actually have a question.
Yes.
Can we just go back over the scalings, the actions for me one more
Yes,
time?
absolutely.
What page was that on?
246.
Okay.
So the scalenes begin on the transverse processes of some of your cervical vertebrae, and they all insert on either the first rib or the second rib. So because these guys are on the lateral side of the neck, when they contract, they will both create lateral flexion. Because they are on the anterior side, only the anterior scalene, but because it is anterior, when these contract, it will pull the head into flexion. So we have flexion and we have lateral flexion. We also see that these muscles run at an angle, so they will also be involved with rotation. Now, specifically at this rotation, it is contralateral rotation. When your right scalenes contract, the head rotates to the left, right? If they were to create rotation on the same side as themselves, this would be known as ipsilateral rotation. I'll type that into the chat box. So ipsilateral rotation, when the left side contracts, they rotate to the left, same side. Contralateral rotation, one side contracts, it creates a rotation to the opposite side. Contralateral rotation.
Okay, yeah, that was my question, the contralateral. Okay. That helps. Thank you.
Of course. Of course. All right. The next section we are going to cover is going to be muscles of facial expression. So we are starting on page 261. Page 261. And some of these, I have a couple of little tricks. So what I would do is in your textbook, kind of next to the muscle, I would write these little helpful hints that tell you what the muscles do. Now, frontalis muscle, we talked about this one already. Frontalis muscle elevates the eyebrows, giving you an expression of surprise. So right next to frontalis, I want you to write the word surprise. Like, ah, the eyebrows lift, the forehead wrinkles. That is frontalis muscle all day long. This next muscle is the procerus. It's kind of a V-shaped muscle right in between your eyebrows. This one gives you the really face. Like when a student is like, oh, I'm sorry, my dog ate my homework. And I'm like, really? This is the procerus, kind of squeezing the eyebrows together. Procerus is the one that gives you those 11s, those two parallel wrinkles. But really? The next group of muscle, the corrugator supercilii, also assist with that really face. Corrugator just means that it's, how do I describe corrugation? Cardboard. Yeah, inside cardboard. You ever notice how it's like two sheets of cardboard and then inside you've got that one sheet that kind of does the wave? That's corrugated. So the corrugator supercilii create like a wave pattern. Supercilii, it is above the hairs. We're talking about your eyebrows or your not eyebrows, eyelashes, above your eyelashes. Hmm?
That's the one that does that too, because you like the word.
Oh yeah. Corrugator supercilii is going to be found right in there. Right in there. Orbicularis oculi. So orbicularis, like orbit, tells you this is a round muscle. Oculi, the word part, ocule or oculo, always refers to the eyeball. So the orbicularis oculi is a round muscle around the eyeball. Now there are two separate parts to this muscle. We'll talk about those in a minute. But these muscles are responsible for blinking and squeezing your eyes shut. So if I were to splash some water in your face and you close your eyes real tight, this is the orbicularis oculi muscle contracting, scrunching your eyes shut. Or winking. Put a little winky face next to it. All right, the anterior auricularis muscle, that first part, A-U-R-I-C, auric or auricule, refers to the ear. These are muscles, you have the anterior, superior, and posterior auricularis muscles. On humans, these things are really thin and really tiny, and they do next to nothing. But on other animals, like if you guys have a dog or a cat, you ever seen dogs, something catches their attention and suddenly their ears perk up? And something else happens and their ears kind of turn to face the direction of where the sound is coming from. Or if you ever looked at like a deer or a horse, how their ears perk up and their ears can like swivel around. That is what their auricularis muscles do. For us, our ears don't really move all that much. But when you have ears up on top of your head that are able to swivel around to face the direction of where the sound is coming from, those auricularis muscles are much more helpful than they are for us. The next muscle is the nasalis. Nasalis, the transverse part, covers right across the nose. So when you smell something that doesn't smell too good, and you get these little wrinkles on your nose, that is the nasalis. Like smell really hard, that's the nasalis muscle, giving you the crinkle nose. So there's your clue, crinkle nose. Zygomaticus major. So zygomaticus tells you that it is starting on the zygomatic bone. We see it inserts onto the corner of the mouth. This one, when it contracts, pulls the corners of the mouth up towards the cheekbones, giving you a smile. So zygomaticus major, one of your smiling muscles. The next muscle, I don't have a fancy clue for it, but it is levator anguli oris. It is levator because it elevates the angle of the mouth, of the oris. So it pulls your mouth up kind of at an angle. So it gives you one of the little smirks, kind of like this. I know who Billy Idol is, but I don't know the Billy Idol lip.
Yeah, right there.
Levator anguli oris. Next we have orbicularis oris. Just like we saw up here. Orbicularis tells you it is a round muscle, but oculi was over the ocule, over the eye. Orbicularis oris is over the oral portion, the mouth. So the orbicularis oris does everything from opening the mouth to puckering the lips up for a kiss. That's how I kiss. Or when someone is, when a girl is taking a selfie and they do the duck face. So if levator anguli oris lifted up the mouth, then depressor anguli oris depresses the corners of the mouth, pulling the mouth down into a frown.
Sound effects.
I know. The last one on this side is the mentalis. Now, this one is a pretty fun one to explain. The Latin word for chin is mentis. So when you start getting really mental and start thinking about a lot of things, we tend to grab our chin. Let me think about this for a second. Mentis means chin. This is also where we get our word mental from, because we grab our chin when we think about mental things. The mentalis originates along the base of the mandible and then inserts along the inferior margin of your lower lip. So when the mentalis contracts, it pulls the lip downward, but its more visible feature is it creates that wrinkling and dimpling of the chin. Anyone have a toddler and seen they're about to cry and their lip curls in and their chin gets all dimpled? That's the mentalis muscle. All those little dimples. That's mentalis. All right. Swinging on around to platysma. We talked about this one already. Kind of blends in around the mouth and jaw, and then goes down the neck to blend into the upper pectoral fascia. Next we have rhizorius. Rhizorius, when it tightens, it tightens up the lips, but to visualize rhizorius, think about like a trumpet player, right? You purse your lips, but then strengthen your cheeks, right? I don't play trumpet, but I've read this book a million times. That's the example they give me. The buccinator. The buccinator is another muscle. It assists with chewing. It assists with stabilizing the mouth if you have to blow, like using a woodwind or a brass instrument. Zygomaticus major. No, we did it on this side. Zygomaticus, no, there it is. Same thing. Okay, Zygomaticus major, and then you have Zygomaticus minor, a little bit smaller, a little more medial. Levator anguli oris, same muscle over here, right? These are the same muscles. They're just cut stuff off so you can see what's deeper. Zygomaticus minor, we talked about. Levator labii superioris, we talked about this one already. Levator anguli. No. Levator labii superioris. So this muscle plugs in about midway along one half of your lips. So levator tells me it is going to elevate something. Labii, labii or labia refers to a lip. So that tells me what is going to be elevated. We are elevating a lip. And superioris tells me that there is, or that it's on the superior side. So it comes down to the upper lip, lifts up when it contracts. This one gives you the Elvis expression. It also would give you a look of disgust. Ugh, ugh, ugh. That one elevated corner of the lip, levator labii superioris. Now, along the side of the nose, we have the levator labii superioris alacanazi. This is the longest named muscle in the body. Wait, the longest name of a muscle in the body, right? Not the longest muscle, but the longest name of a muscle in the body. So as far as muscles go, this is the longest name that you will see. Levator labii superioris alacanazi. It runs from the inner corner of your eye along the lateral aspect of the nose and then inserts about midway down one half of your lips. This is also levator labii superioris. It is also a lip elevator. And then we finally arrive back at the orbicularis oculi. I said orbicularis oculi has two parts. We have the orbital part, which goes all the way around. This is the part that is responsible for squinching your eyes shut. So if someone shines a bright light in your face or splashes water in your face and you squeeze your eyes shut real tight, that is the orbital part. Now, once you've gotten the water off your face, you wiped your eyes off. Now you blink a couple of times to make sure your eyes are clear. that is the palpebral part. The palpebral part is just your eyelids contracting to blink and close your eyes. Alrighty then, so we ran through the general overview. Oh, here's a really good picture of your auricularis muscles, anterior, superior, posterior. But again, these guys are really small and kind of pointless on humans, but other mammals have larger muscles that they're able to use them, again, to use their ears kind of like a radar, so they can turn their ears in one direction or another. Now, for these facial muscles, you guys have been used to like palpating them on yourselves. You're gonna need a mirror to really find some of these muscles because they involve you making funny faces at yourself in a mirror. You've got to experience the facial expression in order to feel where the contraction is happening so you can isolate each one of these muscles. We are going to pick up on page 263. We've got 3 muscles listed on here. The first is buccinator. I do not know how they picked the order that they put these muscles in here. They did not go alphabetically, I don't think, but here we go. Starting with the buccinator. Purse your lips together and press your cheeks against your teeth. So purse your lips and then tighten up your cheeks and you'll feel it in here. The buccinator is located at the center of the cheek. It is a strong muscle that tightens the corner of the lip and presses the cheek firmly against the teeth. Bilateral involvement will help blow a trumpet, suck on a straw, or assist in chewing by keeping the food on the molars. Visually, it can produce a small dimple at the cheek's center. You know what picture this reminds me of? Did you guys see that famous internet kid who, the picture looked like this. His mom confused picture day for pajama day. So she sent him to school. This kid was like 8. She sent him to school for picture day wearing his SpongeBob pajamas. So his picture, his school photo, he's got like the beautiful background. He's sitting in his SpongeBob pajamas and he's like, that kid has my heart. Like, I feel like that almost every day of my life. It's a really funny picture. I would just do like funny kid pajama day.
Oh yeah, that one.
That's the one.
Yeah.
That's the one. Can I see that? Can you see your phone real quick?
Yes.
I want to show them.
He's like, whatever.
Yes.
In his SpongeBob.
Here is this muscle at work. Can you guys see this? His mom sent him to school wearing pajamas on picture day, and he's just like, excellent picture.
Excellent mom.
Funny kid. That's what it was, funny kid. All right, so if the buccinator tightens the cheeks against the teeth like this, then if you puff out your cheeks, then you are stretching this muscle. Next one on our list is the depressor anguli oris. So depressor because it depresses the corners of the mouth, anguli because they come in at an angle, and oris because they attach to the oral portion, right? The orbicularis oris. So it pulls corners of the mouth downward, pulling you into kind of a frown or like more of a scowl. The DAO pulls the corner of the mouth inferiorly and laterally. With a bilateral contraction, it forms an inverted clown smile. Mild engagement is a common involuntary signal of sadness. While a solid contraction is often associated with frowning. Look for it in both reprimands, like an upset parent to a mischievous child, which I feel like we're going to see a lot of with everybody locked at home with their kids, and apologies, like a contrite politician to a skeptical public. I don't think we have any contrite politicians anymore. The depressor labii inferioris. Depressor labii inferioris depresses the inferior labia, the bottom lip. Right? It is located towards the center of the chin, located along with orbicularis oris. It helps to shape the mouth during speech. So this one will be involved if you need to show your dentist your bottom teeth. You would do something like, there it is, depressor labii inferioris. Located just medial to the depressor anguli oris, this muscle depresses the corner of the mouth while protruding the lower lip forward. By doing so, it bares the lower teeth, making it essential for brushing and flossing. The DLI can be seen at sporting events, both on the field and in the stands, and athletes will engage to display determination. Yeah! The opposing fans will use them to express mock anger. Boo! I should be glad you have someone animated teaching you these muscles. If someone couldn't do facial expressions or is self-conscious, it would be really hard to learn this stuff. All right, moving on to the next page. Levator anguli oris. Levator tells you what it does. It elevates. Anguli tells me that it's going to create an angle or it comes down at an angle. And oris tells me what it is elevating. It elevates the angles of the mouth. This short muscle arises off the corner of the mouth and is located lateral to the levator labii superioris. Bilateral contraction will assist in smiling. A unilateral contraction will leave the corner of the mouth giving an impression of self-confidence. Think of like, I got this. But a strong clench will change that expression of assuredness into a smirk. Levator labii superioris elevates the upper lip. This muscle is located medial to the levator anguli oris. Bilateral contraction will elevate and protrude the upper lip like when searching for food stuck between your teeth. So contracting this muscle on both sides will give you an expression like this. So you gotta find your elevating the upper lip. A mild unilateral flex will give you an Elvis-like lip curl, which would look like this. A strong contraction will manifest a contemptuous snarl that displays the canine tooth. Your canine tooth, by the way, if you guys didn't know, the canine tooth is the sharper one here. So you start with your two front teeth. Those are central incisors. Then you have the next teeth to the side. Those are lateral incisors. The next tooth is the canine tooth. All right, there. So when levator labii superioris is strongly contracted, it lifts one side, exposing the canine tooth, giving you a look of contempt. Ugh, ugh. Ew. Next one we have on the list is mentalis. The chin's most medial muscle is the mentalis. Bilateral contraction will elevate the skin of the chin and protrude the lower lip to form the universally understood signal of a pout. Let me get you guys in the light. Notice the wrinkling and the dimpling of the chin. If you press your fingers into it, you will feel it is more contracted than usual. And then relax. Notice how it's much softer. So a stronger contraction will dimple the surface of the chin, forming a more sullen expression. When you are seeing this muscle's effects on the lower lip and chin, be well prepared for a cry of anguish or sadness in infants and some adults. Orbicularis oris. This is a strong sphincter muscle. A sphincter muscle, we recall, is just a round-shaped muscle. When sphincter muscles contract, they narrow in, where's my hand? They narrow in their width. When they relax, they open up. So, strong sphincter muscle encircling the mouth. It is responsible for closing the mouth and shaping the lips during speech and eating. So if you want to, you see an attractive person walking down the street, you want to whistle at them. Pursing the lips is orbicularis oris, or sucking on a straw, or kissing, or singing, if you're an opera singer, woo, whatever. I don't sing opera. The oris is indispensable in brass and woodwind players, as well as to an anguished lover protruding the lips to deliver a long-distance kiss. Because its many strands can act separately, the oris can either narrow or protrude the lips, both signaling different states of anger. See for yourself how necessary the orbicularis oris is for speech by enunciating the Mary Poppins phrase, supercalifragilisticexpialidocious. So a lot of movement in the mouth for that one. All right. Your book goes on to discuss the 7 primary facial expressions. This is something I'm really interested in. In anthropology, when you're studying people cross-culturally, there are 7 core emotions that all humans will express, and they use the same facial expressions for those emotions. Anger, contempt, disgust, sadness, happiness, there's 2 more, surprise and fear. Like base expressions common to all human beings, regardless of culture, regardless of language. Now, what will evoke the emotion of surprise or fear will vary from culture to culture, but those 7 expressions are universal among our species. All right. Next comes the platysma. We've talked about this one already. It is a thin, superficial muscle. They literally copied and pasted, you guys, the info from the last page on platysma. They took the exact same text and copied and pasted it here. So if we know where it is and what it does, it gives you that swamp thing expression. All right, we're going to move right along. Next muscle on our list is the risorius. So yes, the risorius brings you into a smile, but it's a fake smile, right? People smile with their eyes. With a fake smile, you are getting one of these. That is fake AF. That is not a real smile, right? With a real smile, we involve the eye muscles as well. So a genuine smile, we squinch the eyes, you see the crow's feet wrinkles coming in. Like, this is a genuine smile. This is not a genuine smile. Although risorius means to laugh in Latin, the contraction of this muscle may indicate there is nothing to laugh about. Positioned horizontally across the cheek, superficial to the buccinator, it retracts the corners of the mouth laterally and forms an insincere looking smile. Look for it when someone is suffering through an unfunny joke. Fortunately, I don't know what that looks like because I've never told an unfunny joke in my life. Do what? It is kind of a creepy smile. It looks like the Joker pre-Joker-fied. So here is a genuine smile. Note the alliance between the eyes and the mouth. So the mouth comes up, but the eyes wrinkle, they kind of narrow slightly. Let me just jump back. You see how her eyes are still angled down? This is not a real smile. This only involves risorius. But when we involve the eyes, we get a genuine smile that lights up the face. So the zygomaticus major begins along the zygomatic arch, runs obliquely to the corner of the mouth. So start by finding your cheekbone and then just draw a straight line to the corner of your mouth. There's zygomaticus major. This muscle draws the corner of the mouth at an angle and upwards. So it will pull the mouth along the course of this muscle. Lost my place, sorry. Upward and laterally with bilateral contraction, prominently displaying the upper row of teeth. This is the muscle often associated with joy, pleasure, and laughter. When activated with the eye squinting orbicularis oculi, these muscles generate an authentic smile of enjoyment. That's what we see here. However, without the oculi's participation, the zygomaticus's solo smile presents a false signal of enjoyment. So it's still a fake smile if you don't have the eyes involved. This one would look something like this. Hi, okay, take the picture. Take the picture. Oh, it's a video. Zygomaticus minor. Same direction, but slightly smaller and more medial than Zygomaticus major. This one is located medial to Zygomaticus major. The minor elevates and protrudes the upper lip. This actions deepen the nasolabial fold. Nasolabial fold. Hold on, let me find this. Here. There's the nasolabial fold. Nasolabial furrow and puffs out the top of the cheek. Depending on the circumstances, this facial gesture can produce expressions ranging from a smile to a grimace. So note how the upper lip rises up. Zygomaticus minor. Gonna give one of those like, I don't know what the answer is. Right, there you go. Now moving on to the nasal region, we have levator labii superioris aulica nasi. Aulica nasi. Aulica nasi. I know I typed in the word Nazi. It's not Nazi, it's Nazi, like related to the nose. So aulica nasi. This is the longest name of a muscle in the body. That is the longest muscular name that we have. And we often just shorten it to the LLSAN. LLSAN for short, I guess. The LLSAN is a vertical strip along the lateral side of the nose. It elevates the nasal ala. The nasal ala are these coverings of your nostrils, these guys here. So when this muscle contracts, think about you get something stuck in your nose, and you're like, huh, huh, huh. That's this muscle right here. It elevates and protrudes the upper lip as well. A strong bilateral contraction deepens the nasolabial folds and forms diagonal wrinkles across the bridge of the nose. There. Those diagonal wrinkles right there. Ugh. This could generate an expression of disgust. Look for it when a person hears an objectionable comment. No comment. The nasalis muscle. Nasalis tells you where it is. It's going to be on the nose. This muscle is divided into two parts. We have the transverse part, which runs more horizontally across the bridge of the nose. Then we have the alar portion, which is over the ala, or the wings of the nose. So imagine when you smell rotten food, right? Like you open up the milk and you take a swig, whew, that is the nasalis muscle. So the transverse part you could feel right about here, and then the alar portion would be here. So the nasalis consists of two parts, transverse and alar. The nostril expansion can be useful when taunting an opponent, or in some cultures as a discriminating tip-off of one's amorous intentions. In the US, we like wink or whatever to let someone know you're interested. In some cultures, looking at someone and like flaring your nostrils is a signal that you want to spend some alone time with them. I don't make the rules, you guys. I just report them. All right, next up is the procerus. The procerus is kind of a V-shaped muscle starting on the bridge of the nose, going up into the glabella. Remember, that's a bony landmark word, right, for the center of the forehead between the eyebrows. So when this muscle contracts, it pulls the eyebrows down and can squeeze them kind of together. So the procerus gives you a look of perplexity or concentration. Like when I'm really into my work and I'm just sitting there at a computer, okay, looking, I'm very serious. Oh, look at me taking this very, very serious. This is the effect of the procerus. It gives you those 11 wrinkles, those 2 parallel wrinkles on the forehead, pulling the eyebrows together. So I'm either confused or perplexed. I'm like, what are you talking about? What are you talking about? Or I'm just really into my work. Like, I gotta do this math problem. Math's really hard. I don't like math. Small triangular muscle located on the forehead, often more involved with the eyebrows than with the nose. Along with the LLSAN, it wrinkles up the skin of the nose like when you're sneezing and draws down the skin between the eyebrows, creating those horizontal ridges over the bridge of the nose. So again, you looked at what? This wrinkle and the 11s. It often acts in conjunction with the corrugator supercilii to produce expressions of concentration, or perplexity. So we covered the muscles of the mouth. We then covered muscles of the nose. Now we're covering muscles of the eyes. The first one we're going to look at is the corrugator supercilii muscle. Charles Darwin called this the muscle of difficulty because of its involvement with anything demanding, emotional, mental, physical. It's located beneath the medial portion of the eyebrows, and it assists with contraction to pull the eyebrows together. Bilateral contraction forms those 11s, those vertical wrinkles, often creating a frown associated with anger, worry, or perplexion. Perplexion is like confusion. So chronic contraction of the corrugator supercilii will give you those permanent wrinkles that etched in the center of your forehead. The orbicularis oculi is up next. We've pretty much covered this one. I think we've beaten this one to death. I do want you to highlight the first sentence here, though. The sphincter muscle encircles the eye and is responsible for closing the eyelid. Now, we have thicker outer fibers in the orbital part. This is, you see she's got water sprayed on her face. This is for shutting your eyes really tight. And then the palpebral portion is for blinking the eyes. These are 2 portions of the same muscle, guys. It is one muscle with 2 parts. You could think of them like 2 heads of a muscle that are doing different actions, but this muscle isn't arranged with heads. This is one continuous circular muscle. When you are smiling with your eyes, right, you're really getting a full, genuine smile. It is going to involve the orbicularis oculi. Your book gives you a very beautiful illustration of the muscles that move your eyeball. We go in with kind of a sagittal cut through the skull so we can see the eyeball and all the different muscles that move it around. Do not need you to know those, but it is pretty cool. You got a bunch of muscles like strapped to this ball, and each muscle that contracts rotates the ball in some direction or another. So we can move our eyes like up, down, left, right, and all the way around by contracting different muscles located on different sides of the eye. It's a fascinating structure. But nothing that we need to worry about, but it's just really, really cool information to read. So moving up from the eyes, we now move into muscles of the scalp. The first one we come to is the occipitofrontalis. Again, I feel like we've beaten this one to death. Again, they took the same information from a few pages ago. They copied and pasted it here. So there's nothing new that we haven't already talked about or covered. We do get the classic raised eyebrow. Remember, the frontalis muscle is two bellies, so we can contract them individually. So bilaterally, we get the expression of surprise. What? Unilaterally, we get my favorite Spock expression. When the Vulcan raised eyebrow, like, what? You can see the wrinkles where just this one frontalis muscle is contracted, but not the other. So it gives you a look of like curiosity or perplexity. You access the frontalis, have them raise their eyebrows, and then all those wrinkles, you can feel the muscle as they raise and lower their eyebrows. Now, again, this muscle is very thin, so you're not gonna feel a great deal of difference, but you will feel when everything is relaxed, it's more squishy. And then when you raise the eyebrows, the muscle underneath the skin, you gotta feel through the skin, guys, through the skin to get to the muscle. The muscle feels more rigid. Make sure you wash your hands after touching your face though. Next, we have the auricular muscles. Again, this word auric or auricule means ear. It's related to the ear. We have three auricularis muscles. We name them based on their position. So we have the anterior auricularis, superior, and posterior. Front, top, back. Now again, on a human, these muscles are extremely thin and they do very little for us. They are evolutionary holdovers from a time way before modern humans came on the scene. When our ears were larger, we had a little bit more control over them. We see these muscles played out at their best looking at prey mammals, mammals that are prey like deers and donkeys and horses. We also see them to some extent on predator animals like dogs and cats, right? Dogs and cats, their ears perk up and they turn out to the side. The auricularis muscles help direct the ear to the source of sound. So we get more sound vibrations in the ear. We get a better idea of, they can judge distance and things like that. Well, that about wraps it up. The next thing we have, we always wrap up these sections with other structures. We are focused on muscles, so I don't really have a strong need for you guys to learn much about these other structures, but it is good to know, who all lives in your neighborhood. You want to know, like, where's the postman live, and where's the teacher live, and where's the, the bartender, where do those people live in your neighborhood? So when we're dealing with the head, neck, and face, a few things that we do want to be very aware of is we have the common carotid artery. This is the main blood supply to the brain. So this structure is why we only work on one SCM at a time. You do not work on them bilaterally because we cannot put pressure on the artery, cutting off blood flow to the brain. Another important structure that is going on around here, and they didn't even list it on here, the mental foramen on the mandible. You've got two little holes on the sides of your chin. There is a nerve that goes into the mandible on the backside, and it comes out on the front through these holes. These nerves exit and then innervate the lower chin and jaw. You know you're on them when you press your fingers into your chin, search around, you're feeling for a slight depression. When you feel it, press your finger more deeply into it and you will notice, man, it hurts. It does not feel good. That is how you know you're on the right spot. You have important nerves, cranial nerves, exiting through the mental foramen. So you want to be wary when you're working on the face or on the chin. You don't want to put too much pressure right on the mental foramen because you will compress a nerve. And if we know anything by this point, you guys, what do we know about nerves? Somebody.
They don't like to be touched.
There we go. Yeah. Nerves do not like to be touched. They do not like to be poked or pressed or compressed or impinged or in any way have any kind of pressure put onto them. The mental foramen, usually you find the corners of the mouth, draw a line straight down, and then about halfway down, usually roughly where you'll find them. Remember, there's a lot of variation between people, but straight down from the corners of the mouth, halfway between the corner of the mouth and the base of the mandible, that's usually about where you'll find the mental foramina. And that's about it. All right, guys. Well, oh, and we did right on time too. We made good time. So before we break for this afternoon, do we have any questions over anything that we went over? Anything you want me to refresh on? Anything you want me to cover or recap again for you guys? Now's your chance. Sorry, one at a time. One at a time. When is school starting? So the plan, as of right now, is that the school will reopen for students on Monday, May 4th. This plan is completely at the whim of the Florida governor. If he extends the lockdown, then obviously that date is not good anymore. But the plan is that we will reopen the school to students May 4th, and the social distancing precautions would remain in effect. So we have students in the building, but everybody is 6 feet apart. There is no hands-on happening. We're still bleaching everything every hour on the hour. But that's just depending on whether or not they decide to extend the lockdown. The coloring portion of the packet, no, you can skip over that. The rest of the packet I want you to do, but just the coloring book stuff, or like the draw the muscle here, you don't have to worry about that stuff. Just focus on the questions, the multiple choice, fill in the blanks, focus on that stuff, Coral. Do we have news about our graduation? I don't have any news about graduation. When you hit your hours and complete all your services and everything, or not services, your grades and stuff, you will be considered complete with the program. But as far as the graduation ceremony, I don't have any information as of yet. I don't know that there's any way we could safely have that many people in one room graduating, because remember, we are still limited to less than 10 people per room. So even though there are teachers here in the building and we're all teaching online, even we, like when we have a meeting, we can't have more than 10 of us in a room. So some of us end up like hanging out in the hallway listening to the meeting. As soon as I know something, I'll share with you guys, but I don't have no news at the moment, unfortunately.
So I have a question. Like me and my group, I think so we already hit the 600 hours. It's like what is going to be next for us? I don't know.
Let me look into that for you guys. You're talking about you and who?
Nando, Sandro, like my group, like yeah.
I'll look into them. What I may end up having to do is I'll just figure out whatever you guys are still missing. I think you're missing like Spawn Body. You guys already did Allied, so maybe Spawn Body. I'll open up those activities for you on MindTap. You can get those done, and then once you're done with them, you're done. Now your next game is finish massage prep, if you haven't finished massage prep already. Before we went on lockdown, I called the massage prep guy, and I got a 2-month extension for everyone. All the students, you got 2 extra months. That was on us. So we footed the bill. We gave everybody an extra 2 months because I didn't know what to expect with the online thing. And I didn't want anyone to be caught at home without massage prep access. And if I didn't know. And I just thought, better to just bite the bullet, pay the bill, give everybody 2 months. And then, because remember, they shut down testing as well. So they're not even doing MBLEX tests anymore. So I didn't know when they would open that back up. So I wanted you guys to at least have access for a couple of months. And then we would revisit and see what the situation is with testing. So I will go through and see what you guys are missing. If you are missing like 1 or 2 things, I will open those up for you. Focus on those, get those completed. Then you are complete with the massage program. So you won't need to do any more assignments. You won't need to come to these video lectures unless you just want to. You're always welcome. I'd love to have you. Your next top challenge would be to complete massage prep. Once you are done with massage prep and your hours and everything else, then we can consider you complete with the program. Services is the next thing that I don't know how we're going to work this. All the other students in the building are doing services at their houses and recording them, putting them on YouTube. But cutting hair or doing nails is one thing. I don't feel like massage. I feel kind of weird about you guys doing a massage and then recording it and putting it online. I feel sketchy about that. One draping malfunction, man, and this is not the kind of video we want to be watching. So stay tuned. I don't know yet. When are we going to be able to do an MBLEX boot camp if they were still online? Boot camp, stay tuned for that. I've been talking to Lorianne about it, and I'm close to developing a plan for that, but stay tuned, stay tuned. How will the students in my group know where we are as far as hours? I just got progress reports done yesterday, so I will be calling you guys on the phone throughout the rest of this week to discuss your progress reports with you guys. So if the school calls, or make sure you put my cell phone number in your contacts. So when I call you, you know that it's me, the 813-773-6039. Make sure you put my number in your contacts. If I call you or if the school calls you, make sure you answer the phone, because it is likely that we're calling to talk about progress reports. You're welcome. You're welcome. All right, any more questions? Yes. No, it was 813-773-6039. I believe that's what it is. Let me double check. Oh, that's weird. Chelsea Marcinek, I got your text. I'll make sure you get credit. You're good. Thanks, Chelsea. Eight 813-773-6039. Yes. All right. My number's in the chat. Nope. Let me put that to everybody. There we go. So my phone number is in the chat box. Make sure you save me in your contacts so that if I give you a call, you answer, because I'm probably calling to talk about your progress reports. I want to make sure that we're all good. And I just want to say again, everybody in this section, like all my section C's, you guys have all been doing really, really good. Ironically, it's been my intro class that has the hardest time coming to lectures and turning work in, but you guys are doing a fantastic job. Keep it up. Keep it up. All right. Any more questions for me? All right. Well, you guys have my phone number. Call me, text me. You guys have my email address. Shoot me an email. If you guys have any questions, concerns, problems, anything like that. And study hard. Oh, double check MindTap. I uploaded a bodybuilder project that is due on Sunday. Find pictures of bodybuilders and edit those photos. Just rip them off Google or something. But just pull pictures of bodybuilders and label any muscles that you can see that we've covered in face, torso, and spine. Doesn't need to take you too long.
Does this continue next week or not?
Yes.
It does, okay.
Yeah, well,
You can tell me which diagrams I need to study.
yeah, I'm not confident that 1 week is gonna be enough. So the project is due Sunday by midnight, but what I also want you guys to do is study hard, because Tuesday we're gonna recap this material and then I'm gonna put up the test for you guys to take. So I just want, since you guys aren't having as much time in class with a teacher to go over and practice this stuff, I just don't think a week of studying on your own is gonna be enough. But if I gave you at least another half a week, and we had one more lecture where we could just review and recap, and like that's the agenda for the day, is just covering what we've already covered. Is the test going to involve labeling? Your lovely teacher, Lorianne, found a way of doing tests online. So the way, it will have labeling, but you will see the diagram, and each one has a drop-down list. So you'll have the diagram, each blank will have a drop-down list with a list of all the muscles, and you pick. So it will be labeling, but you're labeling by a drop-down menu. Yep. And again, the link to that test will be posted, and as soon as you've taken the test and you've passed it, the system will automatically email me your results, your scores, and all that stuff. So you don't have to do it. Once you take the test and pass it, you don't have to do anything else. You're welcome. So on Tuesday, our lecture, the plan is to review and recap what we have done this week, and I will go through the diagrams and just point out which ones you will need to study for the test. I'll show you which ones will be on the test. That's Tuesday's lecture. Oh, and either Lorianne or Christina will be with you guys. I have to go to a meeting in Fort Myers, so I will not be here, but you guys will have a teacher. I'm not sure which one of you is going to take it, but it's going to be either Lorianne or Miss Christina. Lorianne then. All right, it's settled. So you guys will have Lorianne on Tuesday. She'll review all this stuff, and she'll be sure to go through the diagrams and show you which diagrams will be on the test so that you're studying the right stuff. Oh, thanks, Coral. You're awesome. All right. You guys have a wonderful afternoon. Stay safe, wash your hands, and I will see you guys probably next week. I'll see you when I see you. I'll see you when I see you. You guys have a great day.
Bye, guys.
Thank you.
Thank you.
Bye, Lorianne and Christina. Say bye.
Bye.
Bye.